Mark, how can you say that the rebates are passed purely on to consumers? Are you totally 100% confident about that?
Well, it's up to the health plans who work with PBMs. Health plans hire PBMs along with employers and unions to reduce prescription drug costs and to get rebates and discounts on expensive brand name drugs. We pass those savings on to the plan, and the plan decides how to use them to reduce premiums, out-of-pocket costs, or whatever to reduce costs for consumers. But you throw a new $100,000 drug on the market, not all health plans have that money just to put into their benefits and provide coverage for everything they want. It'd be great if they did, but the high drug prices do present a challenge.
Well, Steve, you know, the study out today from PCMA, the PBM Association, saying there's no correlation between rebates that are negotiated by PBMs and driving up drug prices. But a key message from the drug industry has been that there is an incentive from those in the middlemen, really, in the system, like PBMs, to drive these list prices up. Is that what's happening from your perspective?
Well, there is some misaligned incentives in the PBM model, but even Mark's members, Express Scripts and CVS, have commented this year that drug spending is up in the neighborhood of 3.5%. And we know that net prices are up something like 2.8%. So we actually think drug spending is decelerating. And the real question is the negotiated discounts that Mark's members negotiate with our members are not making their way to patients. We've done two studies. One that showed that our members retain about 63% of the list price of a medicine. Nearly 40% is rebated to other actors in the supply chain, whether that's PBMs, insurers, wholesalers and distributors, government mandated discounts, and so forth. And that 50% of the time, patients in the deductible phase, they're out of pocket spending. 50% of commercial spend for patients is tied to the undiscounted price. So if you or I go to the hospital that's in network, or we go to the doctor, we're paying a price that's negotiated. It's crazy that that's not the case with regard to a person's medicine.
So, Mark, let me bring you back in to respond to that, but also explain what role you play as you see it in bringing down drug prices for the consumer.
Sure. Large, sophisticated payers, employers, unions who provide prescription drug benefits, hire PBMs to negotiate discounts with drug companies because PBMs represent tens of millions of people and have huge negotiating power with those drug companies to bring costs down. We promote generics. That's probably the biggest thing that we do, and we also get discounts on these brand drugs. I agree with Steve that the net costs are not as high as people think because we're able to drive down those costs and negotiate the discounts. That's why Medicare Part D is such a success. There's so much aggressive negotiation. I think Steve would agree with us on that. And the challenge in terms of the rebates being passed on, again, that's another pricing issue, because the challenge for health plans is if prices of health care go up, whether drugs or hospitals, whatever, it's hard for them to just continue to provide coverage on every single thing that comes to market. They want to, we'd love them to, I'm sure Steve would love them to, but there are only so many dollars to go around.
Mark, do you dispute, you know, we had that graphic up just now about the EpiPen, and of course you probably remember that from last summer when Mylan CEO Heather Bresch said that, well, more than half the price of this thing on a list basis goes back to folks like you guys. Do you dispute those numbers?
That thing is one of the biggest scams in the healthcare debate today, because
EpiPen specifically?
The EpiPen economics, that chart there, because EpiPen, what they claimed, the drug makers claimed, was, oh, we had to raise prices because of middleman costs and all these other things. And then as soon as political heat came down on them, they cut the price in half and called it a generic. So what's the big deal? The reality is we negotiate discounts. Drug companies are sellers. We are buyers. Drug companies want the prices to be as much as they can, like any other business. I'm not saying that's good or bad. We represent the buyers who want costs to go down as much as we can. That's just the reality of it. And when drug makers say that they're reluctantly raising prices because of supply chain costs, everybody has supply chain costs. Every industry has supply chain costs. And what we do is we negotiate discounts on behalf of those payers who need those prescription drugs.
Steve, just want to go back to you before we have to go on this. What role do you think you could play then purely in bringing down drug prices? Because, you know, forget everybody else who's in the room, this could also be a one-on-one relationship, right?
Yeah, I mean, everyone in the system can do more. And we think the PBM model, which is really driven by, the greater the discount, the better the formulary placement, needs to evolve to outcomes-based arrangements. So we're actually reimbursing the drug based on the outcome achieved by the patient. So, and I know Mark and his members want to move in that direction as well. But again, our main point is Mark's members are negotiating a harder and harder bargain. rebates and discounts have nearly doubled over the last few years alone. And those rebates and discounts are not making their way to patients at the point of sale. And we have to ensure, particularly with more Americans in high deductible plans that are finding themselves having to purchase insulin for chronic disease, for example, that they're able to access the same discounts that insurers and PBMs are negotiating for everyone else.
We have to leave it there, everybody. Stephen Ubel, Mark, it wasn't a knockdown, drag-out fight, but there was some heat. There
some agreement, some disagreement.
A little bit of friction, right?
Too, is the value.
Buyers and sellers, right?
That's going to be the place to watch.